All right, welcome back, everybody. We've got Dr. Christopher McDaniel joining us today. Dr. McDaniel is an oral surgeon in the area. They actually have 3 offices, Hamilton, Fairfield, and Westchester. So they're all over the place.
Right.
Dr. McDaniel did his undergraduate studies at the University of Kentucky, where he actually played soccer. Pretty cool little thing about him. He did his dental school at University of Kentucky, and then went to University of Missouri, Kansas City to do his oral surgery residency. And I'm just grateful he came back this way afterwards, because we've been working together for a long time, and we're going to be doing the same for a long time. He's also a father of 4, lives right around the corner. We're very lucky to have him. Dr. McDaniel, thanks for coming on.
Oh, Lee, thanks for all the kind words and fun words. But yeah, it's been a great partnership working with Dr. Brown. I think to throw a little bit back towards you is you work at the highest level. You give your patients the best, and it's easy enough that the patients love you just because you have a great personality. So thanks for having me on and being able to chat a little bit today.
Well, thanks, Doc. Hopefully my face isn't red now. Well, hey, let's get to it, man. I get all kinds of questions, day in and day out. When should my kid have their wisdom teeth removed? Or if they're an adult, why should I have them removed if they've been in there for a little while? So how do we answer that question?
I mean, it's a great question. It's kind of a little bit of a debate. We get a number of patients that come into the office, whether it be the patient or maybe the parent, that ask questions like, why should we remove these teeth? Maybe they're not bothering me at this point, or maybe I had one flare up and that was it. There's a long list of reasons why we usually recommend having the wisdom teeth removed. Starting with easy things that you see on a daily basis, or maybe your hygienist sees is, it's called, the bone loss or the periodontal disease or the gum disease that we see around the those healthy second molar teeth that we want to keep. Those wisdom teeth maybe break through half the way or portion of the way, or maybe they're still underneath. They're still causing problems, creating we call it inflammation or enough swelling that it starts to deteriorate the bone around those healthy teeth, and then possibly end up losing those. We start to talk about impacted teeth that we don't see as much, but we still see it on a decent basis as maybe pathology or benign cyst or growth that will show up around those wisdom teeth. The worst case scenario I see is we sit there, we watch the wisdom teeth grow into the side of that second molar, and it actually resorbs or just destroys that tooth. And now we're faced with taking out not only the third molar, but we're also talking about taking out that second molar too. So, I mean, there's a number of reasons why we would recommend having these teeth out and not just neglecting them and waiting till something bad happens.
Yeah, that's a good answer. There's obviously a bunch of variables, but the risk isn't worth the reward kind of thing, it sounds like.
Exactly. And you might, and some people might say, well, when do we have them out? Do we have them out when we're 16, 17, or 18, when most people think that's the time to have the wisdom teeth removed? But I don't look at it as necessarily an age-based decision. I think it's better to think about it as the development of the tooth. So that's why it's important for patients to go in and be seen by, a general dentist like yourself, to take the routine x-rays to verify that the tooth isn't developed and it's not gotten too big. I frequently see a 13 or 14-year-old that maybe needs to have a tooth, the wisdom teeth removed, just because the development of the tooth is about 50% or 75% developed.
Okay. Yeah, that's good to know. Switching gears a little bit, we work together a lot with dental implants. Actually, you've helped family members of mine with dental
Sure.
implants. How long you've been working with dental implants, and what do you do to ensure that these work as well as possible and last as long as possible?
So dental implants are a great option, especially to restore a natural dentition. The things that we do in our office is that obviously we have initial consultation. We're able to discuss the patient's health history. We're able to do a clinical exam to look at how their bite is. Are we setting this case up for success? And then some of the little extras that we have are we have a cone beam CT, or maybe called a CBCT, which just renders a 3D X-ray. Now that we can look at how much bone volume we have how close are we to maybe some anatomical structures that we don't want to, get too close to. And then we also have digital impressions. And so you may think of the traditional impressions with the goop. We're able to use a digital impression to now merge the information from the CBCT with the digital impressions. And now maybe we take advantage of using surgical guides to maybe maximize where the implant's placed so that you could possibly have the best result on the back end for placement of the crowns.
Yeah, the bottom line is you guys use the best materials to create the best results. And obviously with your training and skills, that goes a long way. So that's good to know.
And I'm sorry, and I think I probably missed, I didn't answer your question also. So I've been out of residency since 2012. So going on 8 years of implant placement out in private practice. You have 4 years of residency before that where we're training and placing implants. And even in dental school, we had a little bit of time where we worked with, learning how to place implants or, at least work up a case. So.
Yeah. And I could say right now, in the 8 years that we've worked together, right now we're batting 100%. And a lot has to do with a lot of the little steps that we try to take ahead of time and behind the scenes to help people out. So let's keep that going as much as we can.
That's right. And many people will maybe even wonder, is this, how much of this is a team approach? It's very much a team approach. It's you that are taking a look at the patient clinically at first. Communication, which we have a great line of communication, and in the materials. You're right. Yeah, I know you don't use any secondhand materials. The implants that we're putting in are very much the top line, the most researched and the most used out there.
That makes a world of difference. Now, if someone were to come to you today and say, Doc, should I get implants? Should I not? What's something you would say to someone based on your experience, some of the success stories that you've seen?
I don't think there's a question about it. There's nothing better to restore a missing tooth or multiple teeth than dental implants. Patients that maybe go through the process, maybe it's a quick process, maybe it's a little longer. I don't think there's a patient out there that regrets going through the steps it takes to get a proper implant placed. It restores their ability to, chew the foods that they want to go out and live the normal lives that they have, enjoying friends and family without having to worry about, is something loose or holding something in. And now you start talking about the aesthetic areas, the teeth up front. Yeah, there's no question that patients that get implants and crowns put on and they're done well, absolutely love it because now they can smile. Now they're back to their normal selves, and maybe it's things that they don't really think about, but it really does help out.
Absolutely. And for a perfect example of that, go to our website, go to our Smile Gallery. There's a great case that Dr. McDaniel and I did together where we replaced the front 4 teeth with dental implants. It's gorgeous and it's going strong. Doc, thanks for your time, man. I know you got a lot going on, but we'll talk more soon.
Sounds good, man. Always nice to talk to you.
Bye. Now, Chris, what I'm going to do,